everyone. This is our project on infants. In the video, we will be talking about sleep safety, growth and developmental milestones, safe food choices, and vaccinations. Patient 1 is 1-month-old Millie.
Hi, Miss Heron.
Hi, how are you?
I'm good. How are you?
I'm good.
I see that you're here for Millie's 1-month well shot visit.
Yep.
Do you have any concerns before we begin?
I don't think so.
Okay. Millie's growth chart seems to be on track with normal development, so that's nothing to worry about.
Okay.
How's she been sleeping?
She sleeps good. She normally sleeps throughout the night. She likes to sleep on her stomach. She sleeps easier that way. When I do put her in her crib, or sometimes she sleeps on like a little bean bag, I normally always give her a blanket. She has toys and a bottle with juice. I don't normally give her a pacifier because I read that those were bad. And sometimes my husband falls asleep holding her.
Okay, time out. I'm going to give you guys a couple seconds to see what's wrong with this picture. If you said a bottle of juice and food, toys, blankets, a pillow, a nightcap, and sleeping without a pacifier, you're right.
Well, I'm glad that you want your baby to be comfortable, but I do notice that a lot of the sleeping habits that you have for Millie really increase the risk for SIDS.
Oh, okay.
So instead, you should really place Millie on her back when she sleeps, on a firm mattress, with no other objects in the crib, and preferably with a pacifier. Those all decrease the risk of developing SIDS. And preferably alone, just to decrease the risk of suffocation. Is there anything else that you need?
I don't think so.
Okay, the doctor will be in shortly.
Okay, thank you.
Hello, hello, hello.
Hi.
Hey, baby. So, the nurse from before talked to you about SIDS, right?
Yeah.
So, do you know what that is?
Not really.
Okay, so it stands for Sudden Infant Death Syndrome.
Okay.
And the cause from that is usually from sleeping habits.
Mm-hmm.
So, like you said before, she was sleeping on her tummy. You had a lot of blankets and pillows with her, and toys and stuff like that. As well as co-sleeping. Yeah, co-sleeping is a risk for suffocation and asphyxia. So you need to talk to your husband about that.
Okay.
But lastly, I want to talk to you about vaccines.
Okay.
The vaccines actually help with immunity, which also helps with SIDS.
Mm-hmm.
So in a month, at her 2 months of age, she needs to get the Hep B, Tdap, HIV, IPV, PCV, and rotavirus vaccines. Do you have any other questions?
I don't think so.
Okay, be sure to get that checkup.
Okay.
Patient 2 is 8-month-old Griffin.
Hi, Miss Patty.
Hi.
I see that you're here for Griffin's 8-month checkup.
Yeah.
It seems that you haven't been here since he was 4 months old.
Yeah, we haven't been here in a while.
A lot of stuff can change in 4 months, so let's talk about that.
Yeah.
Have you introduced any solid foods?
Yeah, I have actually. He's been eating some solid foods. I've given him a new food every day or two, and I've given him some things like hot dogs, which he really likes, some grapes, some peanuts, and he really loves melon with honey on it.
Okay.
All right, another time out. See if you can tell me all the foods that are not appropriate for an infant. This was actually a trick question, because all the foods shown here are not appropriate for an infant to have.
It seems that you've provided Griffin with a large variety of foods, but there are some things that we probably should talk about.
Okay.
New foods should be introduced around 4 to 7 days apart, just in case if he were to have a reaction, you would know what food he had a reaction to.
Okay.
And honey shouldn't be given before the first year of life because of the increased risk for botulism.
Yeah, I've heard of that.
What have you noticed in Griffin's changes in his movements and activity level?
Yeah, I've seen him more active, and when he's playing with his toys, I see him crossing from hand to hand. I've seen him pull up on furniture, and I've seen him pick up some small objects like Cheerios and things.
That's awesome. Everything seems to be good. His growth and development seems good. The doctor will be in with you shortly.
Okay.
Hi, Miss Patty. How are you?
I'm good, thanks. How are you?
I'm good. So I'm just the doctor. I'm just here to talk to you about the vaccine schedule.
Mm-hmm.
So at 6 months, we start introducing DTaP, HIV, IPV, PVC, RV, and Hep B again. And we also give the flu vaccine, and since it is flu season, we were going to start with that today.
Okay.
And I know that you missed your 4-month checkup, but I just didn't want you to worry about that because we're just going to start him on a catch-up schedule.
Okay.
So do you have any questions?
No.
Okay, the nurse will be in just a few minutes to administer.
Hi, Miss Patty.
Hi.
I'm back to administer Griffin's flu vaccine.
Okay. Is there any way we can make this less painful for him?
Yeah, you're more than welcome to hold him while we give the vaccine.
Okay, and where are we going to administer this?
We're actually going to give it in his thigh.
Okay, so should he just be laying down on my lap or sitting?
Yeah, that's fine.
Okay.
As a quick recap, infancy teachings are important. As Nurse Chloe corrected Millie's sleeping habits such as a firm mattress, placing the baby on their back, crib-free of blankets, pillows, toys, and bottles, and avoiding sleeping with the baby in the bed, in which all these help prevent SIDS. Nurse Chloe also pointed out milestones in the visit, such as 2 months lifting head during tummy time, and coos. Around 4 to 6 months begins babbling, around 7 months starts crossing toys midline, and including the pincher grasp starting around 8 months. 10 to 12 months begins to pull up on the furniture and starts cruising. Also at the well child visit, vaccines were mentioned and administered, such as diapher, which includes DTaP, IPV, Hep B, HIV, PCV, and rotavirus. These are administered at 2 to 6 months, along with administered flu vaccination beginning at 6 months and older. Nutrition is also important to a well child visit. Nurse Chloe explained that things such as honey should be avoided because of botulism. Peanuts and grapes should also be avoided for the aspiration risk, and foods should be introduced every 4 to 7 days to ensure no anaphylactic reaction. During infancy, you see the sensomotor stage where infants explore things by their mouths, playing with things, picking things up, touching things, and through taste.
As a nurse, we have to follow certain cues and competencies. For number 1, providing patient-centered care, she focused on Millie, Griffin, and asked the parents if they needed any help or had any questions. For number 2, she demonstrated teamwork and collaboration by talking with the doctor about the vaccines. For number 3, applying evidence-based practice, they used research to know when to give the first shot of influenza to Griffin, which was 6 months. For number 4, utilizing quality improvement principles, traumatic care by letting Griffin stay on his mom's lap. For number 5, ensuring safety in practice. The room was free of clutter and safe and didn't have anything dangerous, and made sure to pick the right spot for the vaccine administration. For number 6, use of informatics and technology, using the MAR for the medication administration for the vaccine.